Hello, my name is Jolene LaRock and I am the respiratory educator. I just wanted to talk a little bit today about the 3M Multiport tape that we will be trialing in the NICU and PICU. This will be starting on Monday, May 7th, and we will be trialing for approximately 1 month. We're hoping to get 10 patients in both patient populations. Okay, so just talking a little bit about the tape. So this tape is a great tape. I've used it in the past. It has a backing to it. There is the 1-inch width tape and the 1/2-inch width tape. So we are not changing our taping procedure, simply the tape that we're using in this trial. So the tape itself has this great backing to it, so when you're actually cutting the tape, your scissors are not sticking to the tape at all. You can see it's very easy to cut without any issues of sticking or having to place it on anything. So the best way to get the backing off the tape is to just give it a little twist and a pull. And as you can see, this takes the backing off quite easily. So the one change that we will be making as far as what we are using underneath the tape, we will be using our Smith & Nephew skin prep. And this will be for the NICU and the PICU, so no benzoin in the PICU. So what you'll do is you'll just take the skin prep, make sure your skin is nice and dry and clean. You will open the skin prep and apply evenly in one layer to both sides. Make sure that it dries. It usually dries within about 15 seconds. All right, once the skin is dry, you will take your tape. You want to avoid what they call tape strapping, so you do not want to start on the side and pull the tape. So the main thing with this tape is that you don't want to pull it and change the shape of the tape. Even though it is easily flexible, when you're changing the shape of the tape itself, then it's not being used correctly. So when you're applying the tape, what you're going to do is you are going to apply starting at the center. You're going to want to make sure that you use a good amount of pressure just to make sure that you have the tape securely onto the skin, okay? So we're going to start in the center, and it adheres really well. You're just going to make sure you're using pressure, okay? And you're going to make sure you have the top layer of tape on well with the skin. Now when we do our wraparound, an important thing to remember is we don't want to pull the tape and stretch it and change the tape at all. So what is suggested is that when we wind it around, to make sure that it's on the tube, and we're just kind of going to pinch it a little bit just to make sure that it is on securely, okay? So you're going to wrap around twice like you normally would. And then same thing when you're actually putting the edges of the tape onto the tape itself. You don't want to overly pull and change the tape at all. What you're going to do is you're just going to apply some pressure onto the tape itself. So this tape has a raised diamond pattern to it. You want to make sure that we're working that adhesive when you put one piece on top of the other well into the bottom piece so that it is adhering well. We could take our other side then and continue like we normally would, not pulling the tape, same as before, but making sure that we are just pinching the tape onto the tubing itself and making sure that it is nice and secure, and then placing our top piece on using pressure, okay, and make sure that the tape is adhering well to the bottom piece. So our 1/2-inch tape actually works great for creating the mustache. You can just cut your piece. Same thing, you're going to give it a little twist and a pull, and as you can see, the backing easily came off. You're going to apply that same as the first piece. You're going to put it in the center, not pulling on the tape itself, but applying pressure and working your way out from the center, okay? So it is a moisture wicking tape. It works really well. It also sticks really well, like I had said, to critical tubing. So if you need to pull the ET tube back at all or advance it at all, what the company recommends is first to use our clinical judgment, and second, if we notice when we take the tape off, okay, so say you've just intubated the patient, you got an x-ray and you need to change the position of the ET tube, okay? So when you're taking the tape down from the tube itself, since it's got such a high affinity to critical tubing, when you're taking the tape down, okay, it has such a strong affinity that it will sometimes stick to the tube itself and not necessarily remain attached, I should say, to the tape. So it does have the chance of that separation. So, I mean, granted, you intubate and get an x-ray and need to either advance or pull back the ET tube within, you know, an hour, 2 hours, that should be fine. They're more suggesting the 8-hour, the 24-hour mark and beyond. They would recommend getting a whole new set of tape, just because it will attach to this critical tubing and separate from the back of the tape itself. Okay, so the skin prep that we used before we put the tape on works also really well in taking the tape off. You could also use some moistened gauze pads to take it off, but what you can do is you can just use a skin prep, okay, right on the edge of the tape, and you're just going to work the tape off. All right, and we're gonna take it off what they call low and slow. So what you're going to do is be supporting the skin while you're peeling back the tape itself, okay? And you can also use this Smith & Nephew prep to gently take off the tape as you go. But what you want to do is you want to support the skin, okay, while you gently pull it back and avoid just that pulling motion of taking the tape off. So that is pretty much the important education info for the tape. We will be keeping a 3M tape trial box in both the NICU and the PICU. It'll have scissors in it, rolls of each size tape. It'll have the skin prep, evaluation forms, and the PICU will also contain measuring tapes and the guide for cutting tape that we have been using. So the evaluation forms, we ask everyone to fill them out when they're applying the tape. You can fill it out at any point while the tape is on the patient, positive or negative. We want to hear all your input on that. And we also ask that you fill it out when you're removing the tape, either to retape an ET tube or for extubation. And there is some information we're looking for as far as skin integrity after removal, and that is on the evaluation form. So blank evaluation forms will be left in the boxes. Please fill them out and return them to this box, both in the NICU and the PICU. I will collect them in the NICU. Christy will collect them in the PICU. We will make sure there's plenty of empty forms in both areas. In the PICU, the box will remain on the cart where your current airway taping box is. And in the NICU, it will remain at the respiratory desk. All right, if you have any questions, please let me know. Most of your fellow staff has also been trained on this, so feel free to pick their brains on it. Take a look at the tape, get some hands-on with the tape, just cutting it, feeling it, seeing the stretch that can be involved in changing the shape of the tape. We value your input, and any questions, please let us know. Thank you.